Hello, employees. Today we're going to talk about a particular workplace issue, and this is the use of social media within the workplace and how it affects employees and managers as well as patients. We're also going to add on to our knowledge on the topic, go a little bit more in depth, and also look at how social media has an impact on the work environment as a whole and how we can really prevent social media from having a negative impact in healthcare facilities. Well, let's start off by talking about what is social media. Well, social media is a way for individuals and communities to communicate with each other, share ideas with each other, share different types of content, and also share and obtain information. And there are various social media outlets that can create the means of communication that people use to communicate with each other across the world. We'll talk about that a little bit later. And social media is used by professionals and businesses in all different types of fields of work, not just healthcare. And over the years, the use of social media continues to increase, and with the new development of technology and the creation of these different social media outlets, I'm pretty sure we can see the use of social media continue to increase over the years. Alright, so let's talk about healthcare professionals and social media. Well, as we all know that we all use social media one way or another, as do healthcare professionals. They're not excluded from the loop. They use social media for personal reasons, like to communicate with family members or friends. They also use it for business reasons, probably to contact patients. And also, they use social media to obtain knowledge on new medical technology by reading articles online. And of course, they use social media, different platforms to communicate with their patients and also communicate with other healthcare professionals around the world. So, some social media outlets that healthcare professionals use, well, not only healthcare professionals, but really your common social media user can use any of these outlets, not only limited to healthcare professionals, but some of these media outlets include social networking websites such as Facebook, Instagram, Twitter. This is usually to communicate for personal reasons. And some professional networking social media outlets include sites like Sermo or Doximity. These are physician exclusive websites that healthcare professionals can use to communicate with other healthcare professionals exclusively. All right, and some social media outlets that allow for media sharing is websites like YouTube. This is where people can go to view all kinds of videos, very interesting videos that obtain so much information, in fact. There's also content production websites such as blogs, Tumblr, etc. And there's also knowledge sharing social media outlets such as Google, Wikipedia, WebMD, which I'm sure most of us have used before when searching up a certain type of symptom. When we get sick, we use WebMD a lot, and so do a lot of healthcare professionals and patients. All right, so patients and social media, when we look at this topic, we can see that patients use social media to seek medical information. As mentioned before, whenever we get a symptom, a cough, we get a headache, we usually look up the symptoms online and try to figure out what might be wrong with us. Also, patients use social media to get a consultation from a doctor or any healthcare professional that they can find to contact online. Patients also use social media to share health related experiences with other patients. So, like, kind of providing feedback on different healthcare professionals and different healthcare facilities. It's kind of like a Yelp. We leave reviews on what we experience so that other patients can be informed. All right, and also patients use social media to look up various healthcare professionals and facilities. So, as we just talked about, patients who are looking for a good healthcare professional to see or a good healthcare facility to go to, they might look at the reviews online that other patients talked about or left good reviews about or bad reviews. All right. And lastly, healthcare patients, they use social media to contact healthcare professionals. This can be to like set up an appointment, ask about different prescription drugs, those kind of things. Although this presentation is about how social media can be a workplace issue, there's no denying that there are pros of social media within healthcare, and we're going to talk about some of the pros. So, well, social media offers healthcare patients easily accessible healthcare services like never before. Although, of course, it doesn't replace meeting up with a doctor in person and getting that physical experience with an actual healthcare professional. However, there are means where you can actually talk to a doctor online and get that one on one experience. It also offers patients convenience. So basically, everybody has a phone or a computer right at their fingertips, and it's so easy for us to, schedule an appointment, talk to a healthcare professional, or ask questions at certain healthcare facility just by calling them, just from the touch of our fingertips, which is never really available before there was social media. Another pro of social media within healthcare is the ability that it gives us to explore our healthcare options. Social media really gives us so much information about the different steps that we can take to, go on with our health situation or the different plans that we can choose to fund our health situations. And social media really just helps us make these vital decisions when it comes to our healthcare. Right? Social media also gives us the ability to share our testimonies. We can also listen to the testimonies of other patients and kind of connect with them and encourage one another to, you know, live healthier lifestyles, choose healthier options in life, and really take care of our overall health conditions. So, the last pro of social media within healthcare is the vital medical information that we are able to obtain online. Really, there's so much information out there. I know I've said this before, but really, we can't even begin to comprehend how much information there is out there online that really anybody can access just by simple Google search. And when we think about it, back in the day before there was social media, it was really hard for patients to get certain medical information. That's why social media is so awesome. It makes life so much easier for us. Okay, so now that we talked about all the facts behind social media and healthcare and also the pros of social media and healthcare, let's go ahead and talk about why social media is actually a workplace issue for the healthcare environment. Right, so social media produces the risk of incorrect or poor quality information. So, of course, as I talked about before, how there's so much information online, there's just no way of telling if most of that information is actually valid or was posted by credible sources. Anybody can post information online, and there's no way to really fact check that. So, patients really have to be careful when they're looking up information online and make sure that it was posted by credible sources, because there are so much invalid information as there is helpful information. So just be aware of that. Also, social media produces the risk of harming professional image. We talked about before, patients, they're able to share their experiences that they had with certain healthcare professionals or within certain healthcare facilities. And if these patients, they leave bad reviews on these physicians or facilities, it can really harm their professional image and can really put a damper on business, because less patients will want to see that physician or go to that facility, knowing that there are other patients out there who have had bad experiences. This is not the only way that social media can harm professional images of healthcare professionals. Actually, healthcare professionals can harm their own image by what they post on social media, knowing that, you know, social media isn't filtered, they can post whatever they want. Sometimes these healthcare professionals do not think before they post, and the things that they say are not really tasteful or professional in any manner. This can also put a damper on business when patients see this. They're less likely to trust these healthcare professionals to treat their health. All right, so another con of social media within the healthcare is the risk that social media produces for breaches in patient privacy. And one way that this can happen is through hackers and viruses that hack into databases that store patient information online, and share that information through social media, which really is confidential information and should only be seen by patients and their healthcare professionals. And this is trusted information that patients trust their healthcare facility to keep confidential and out of the reaches of hackers and viruses, so that their information doesn't get into the hands of someone that they don't know or that they don't want knowing their information. All right, so another con of social media and healthcare is the risk of violation of personal and professional relationship within the healthcare workplace. So, an example would be how we talked about how it's so easy for healthcare professionals to contact their patients on social media through various social media outlets. But when not used correctly or properly in a professional manner, this can lead to some healthcare professionals overstepping their personal professional boundaries that they have with patients. In addition to that, we also mentioned before that there are social media outlets that allow healthcare professionals to connect with various other healthcare professionals. But when these workers do not use those social media outlets for what they're intended for, then that's where we have a problem. And this is how harassment can come into the picture, which can create very, very big legal issues for the healthcare facility that the certain healthcare professional resides in. Okay, so the last con of social media in the healthcare workplace that we're going to talk about is the improper use or misuse. while working, of course. What this is really present in any work environment where employees have access to computers, cell phones, sometimes they take advantage of the fact that they have the convenience of their cell phone and computer right at their fingertips, and they are on social media so much that they become less productive as an employee, which really takes away from the organization as a whole, due to the fact that social media is so distracting and it can really disengage employees from their current work environment. All right, so next we're going to talk about the current ways in which this workplace issue is being addressed. So let's talk about laws and regulations first that have been established by the National Labor Relations Board. All right, so it's key to note that because of our First Amendment, freedom of speech, that it's really hard for state, federal governments to really crack down on social media use because it's a way for people to express themselves and practice their freedom of speech. However, there are, in fact, some laws and regulations that are put into place in order to kind of control the way that healthcare professionals do use social media. There are laws and regulations that do prohibit offensive or inappropriate posts online. So, employees have to be extra careful when they do post online just to ensure that they're not breaking any policies established through these regulations and laws. Second, there are laws and regulations that prohibit online discussions of legal matter or confidential information, and this is just one way to protect patient information and make sure that no confidential medical information is being shared through social media outlets, because these healthcare organizations do have a federal obligation of protecting the confidentiality of these patients, which is why it's so vital for employers to ensure that employees are not sharing confidential patient information online because it does violate federal law. There are also laws and regulations that encourage employees to report invalid use of social media by coworkers. By doing so, it really helps organizations to crack down on improper use of social media by informing them exactly what is going on in the workplace and working towards getting employees to practice positive social media use, which doesn't have a negative impact on the work environment. There are also current laws and regulations that discourage personal relationships between coworkers and patients. Well, the reason for this is pretty obvious because it's in everybody's best interest, the employer, the employee, coworkers, and the patient, to ensure that healthcare professionals are, maintaining strictly a professional relationship between each other so that nobody oversteps their boundaries. And there will be less room for personal drama within the workplace, which can really have a negative impact on the work environment, and also leaves less room for harassment between both coworkers and healthcare professionals and patients. Lastly, there are also current laws and regulations that prohibit employees from using their employer's logo or trademark online. And this is because if an employee is posting or decides to post something very inappropriate, that employee will not be associated with a certain healthcare organization because, of course, it can damage professional images, especially a healthcare organization that that employee is a part of, which has nothing to do with that employee's particular online social media post. These laws and regulations are taken very seriously by various healthcare organizations, and if any healthcare professional violates these laws and regulations, it is punishable and can end up in termination from that healthcare organization. The policies for this organization is short and simple, and we're gonna talk about it, explain it more in depth. So, the first policy that we have is the phone can wait policy, and this is for all you employees who love to go on social media on your phone and the computer. Well, in this organization, you're just gonna have to wait until you get home to go on social media because we really want our employees to be 100% attentive, focused, present in our current situation in the work environment because we want to be as productive as possible. And social media can act as a big distraction for employees, and we do not want that. All right, so the second policy that we have is are you being honorable policy. And this is really just a reminder for you employees to really question yourself before you press send, to really think about what you're saying and does it honor your obligation that you have as a healthcare professional, and can you really be proud of what you're saying. And if you can't be proud of what you're posting, then you really have no business posting it. So, again, no matter if you're outside of work, we really encourage you to think twice before pressing send because there are consequences for dishonorable posts. The third policy, don't even think about it, is talking about sharing legal matters or confidential information online. Don't even think about it. Don't even try to discuss it. Nothing. Keep that information where it belongs in private. Do not bring it outside of the workplace or online because there will be consequences. So, this fourth policy is sort of similar to our second policy. Remember that you represent this organization. Before you post something, before you send a message to somebody, please remember that you are a representation of this organization. And if you are not acting in a professional manner and being distasteful, dishonorable, you really represent our organization. And what you do can impact everybody that you work with. So just remember, always, always, always act with integrity. This organization takes our policies for social media use very seriously, and we do have consequences for employees who do not follow our procedures. So, here we have your typical three strikes and you're out policy. The first time that an employee violates our social media policies, it will result in an infraction. The second time an employee violates our social media policies, it will result in suspension for at least 3 business days. And the third time that an employee violates our social media policies, it will result in permanent termination from our organizations. So we really, really encourage you guys to really follow our policies. It's very simple, and termination is the worst case scenario that we want our employees to experience. So please, guys, always think before you go on social media and do something that violates our social media policies. All right, employees, with that being said, that will conclude our training video on social media. I truly hope that you use this information given in this PowerPoint to guide your actions in the future, and I look forward to a very productive work year for everybody.